Assalamu alaikum. Welcome to another episode of our health show. The topic for discussion today is going to be something that's very interesting. There are three kinds of pain that are unbearable for the humans: pain due to the heart, pain due to the teeth, and pain due to the kidney. The topic that we are going to discuss today is going to be based on kidney stones, which is one of the most common problem in tropical countries. And to talk on that, we have with us Dr. Ali Akbar Zahri, who is a consultant urologist at Aga Khan Hospital. Welcome to our show, doctor.
Thank you, Fatima.
Starting with our first question, what is a kidney stone?
Kidney stones basically are hard mosses, and they are crystal-like crystals, and they initially small crystals forms in the kidney, and then they increase in size, attach to the wall of the kidney, and later on they can migrate into the any lower part in the ureter or in the urinary bladder. They can block the urinary system and gives pain.
So pain is the hallmark symptom.
Pain is hallmark, as you said before.
How common is kidney stones?
Kidney stone is one of the commonest disease, and its incidence is mostly in the 3rd to 4th decade of the life, and it increases the incidence increase in more in male as compared to the female, and as the expenditure increases, the kidney stones increases. And if you will see in advanced countries, the incidence is around 5% in the females and 10 to 12% in the males. However, there is no population-based study regarding Tanzanian. There are a couple of studies from Muhimbili Medical Center. They are hospital-based studies and showing that the incidence of stone is almost same as the Western world.
What is its relationship to sex? Like you said, it's more common in males and females. Is there any reason for
yes,
that?
Yes, the relation is, in females they have estrogens, and estrogens are preventing the females from the kidney stones. One of the most common causes of the stones is the calcium and oxalate stones, around 70 to 75%. So females are less prone to have a stone as compared to the males.
And is it common in children?
It's not common, but it is less common as compared to the male. As I said, in the male, if it is 10 to 12%, so in peds or in children's, it is almost 5 to 7%.
So does it have any genetic predisponence?
Yes. If, for example, there is a history of stone disease in the family, then in that generation, yes, the risk of having a stone in the family, the other members of the family is more as compared to in those population where the family history is not positive.
When we say of kidney stone, so what is this stone made up of? As in, what is its chemical composition?
Yeah, the kidney stones are chemicals, and they are mostly formed by calcium, oxalate. They form the 60 to 70%, as I said before, and there are infectious stones as well. And there are certain metabolic disorders they can lead to kidney stones, like hyperparathyroidism, like increased concentration of uric acid, or those they have a gout, right? And those patients, they have a metabolic kidney disease like hyperoxaluria is one term, and hypercalciuria. They are more prone to have kidney stones.
So why do they form?
The reason is basically dehydration. Exact mechanism is still not known. There are certain theories. Whenever there is an imbalance between the, God has given us preventive mechanisms. There are certain chemicals, they are preventing the stone aggregations,
In
like
the kidney
citrate.
itself.
Yes, the kidney itself. Whenever there is an imbalance between the ingredients which are increasing the stone formation and the inhibitors which are preventing the stone formation, so then it leads to concentration of the urine, and these concentration leads to crystal formation, and crystal then later on attached with the papillae of the renal pyramid, and from there it increases in size and form a stone.
You said one of the main cause of stone formation is dehydration. So since we live in a tropical country, we are very prone to get dehydrated. Are there any signs of dehydration?
Yes, signs of dehydration: dryness of mouth, low blood pressure, dryness of the skin, especially in hot climates where people are sweating a lot, and if in those they are working, they are not taking plenty of fluids. So this is one of the reasons that they develop dehydration, or sometimes it is especially in the child's loose motions, diarrhea. They can also this sort of disease also can lead to dehydration, but that dehydration is not associated with any stone disease. Overall, for example, a dehydration of a short period is not a risk factor. If somebody is living with dehydration for a prolonged time, then yes, the dehydration is the cause.
You talked something on calcium stones, the stones that are made up of calcium. Is there any relationship between an increased calcium intake, such as that in dairy products, and the stone formation?
Yes, there is an increase, because as I said before, if the calcium concentration increases in the blood, so the excretion of calcium from the blood into the urine is called hypercalciuria, and then hypercalciuria is a risk factor for stone formation. Dairy products, 1 to 2 cups of milk is allowed. You can take. If it is more than that, then the risk of stone disease is there. But you can't, stop taking dairy products, because it is important. Remember one thing, that if, for example, you are taking oxalate, like chocolates, like a tea, if it is with milk, then the risk of oxalate to absorption is low, because one of the other second risk factor of stone formation is oxalate, in spite of calcium, right? So what happened in the intestine, the calcium bind with the oxalate, and then those bind form of oxalate and calcium will excreted into the feces. So that is one of the prevention. For example, somebody is taking coffee, somebody is taking kahawa, so he is on more risk that he can develop a stone, as compared to those if they are having a tea with milk. So that's the reason that the oxalate can excrete into the feces.
So this is a very important information for viewers, for those who are tea addicts. They would rather have tea with milk rather than having the tea alone.
Alone, yes.
Right? What are the common symptoms of kidney stones?
In the beginning, you said the pain.
The hallmark symptom,
yes.
yes.
Pain is the most common symptoms, and sometimes there are silent stones as well. The stone is there and it's not giving symptoms. And when you, for example, a patient present with another disease, and doctor is doing any investigations to find out that there is a stone in the kidney. So basically, a bulk of stones are asymptomatic until unless they move into the ureter, or they block one of the calyx of the kidney, or they move inside the kidney, then it gives pain. So pain is the most common. Second symptoms, they can give fever, right? Why fever? Because stones are more prone to have infection, and infection one of the cause of fever. Second, sometimes patients present with blood in the urine. There is no pain, but there is blood in the urine. As the stones move inside the kidney, they can irritate the mucosa. They can cause damage to the mucosa, and there may be a bleeding. Sometimes patients can present with the asymptomatic even a blockage that was not painful, or he was taken painkiller taken by a local doctor, so they can present with a mass or any bulge in the right or on the left side. It is rare, but it can happen.
When you talk of silent stones, why are they called silent stones? As in, like, because if there's a stone formation, so pain is likely to be there. So is it because they're small in size, or is it because they're large in size, but it just doesn't present with pain?
As I said, kidney is formed by calyces, and those calyces are then joined and form the renal pelvis, and from the renal pelvis down is the ureter. If any stones in the lower part of the kidney, which is not blocking the kidney, so those stones are asymptomatic. They are not giving any pain.
So they can keep growing in size, and the person doesn't.
So whenever there is a stone, there are two possibilities. One is either that stone can flushed into the urine and come out spontaneously, or it can stay there and increase in size. These are the two possibilities.
So these silent stones, like if they are situated in the lower part of the kidney and they do not present any symptoms, how dangerous are they?
They are dangerous. As I said, stones can cause infections, number one. Second, if the stone is small in size, less than 4 millimeter, in a place in the kidney, it is not causing any blockage. However, we can't just ignore it or forget it. We have to do ultrasounds in a 6-month duration time if there is no pain, and to see, as I said, because this either is going to be flushed into the urine or it increase in size. So it's dangerous if, for example, if it increases in size, causing infection slowly, and sometimes what happened, it causes one of the calyx blockage, and that calyx increases in size and thinning of the parenchyma, and ultimately leads to an infection and pus formation inside the kidney, and that is dangerous. Sometimes can lead to kidney failure as well.
So it does lead to acute kidney failure.
Yes.
What are the tests that you do to diagnose kidney stones?
Test, yes, we start with the, as the patient comes with the pain, so first you have to treat the pain. After that, definitely after taking a good history and examination, then you need some investigation to confirm your diagnosis. Those investigations are urine analysis or urine detailed reports to see is there any evidence of blood in the urine, because most of the time the stones can give blood. Is there any evidence of pus cells, means infection in the urine? And second, we do kidney functions test to whether kidneys are normal. As I said, sometimes stones can increase in size, and we said one of the stone type is called Stegan stone, almost 5-6 centimeter and asymptomatic, and the patient comes to know when the kidneys are totally gone, means he or she is in renal failure. So you have to do a kidney function test to see what is the function of kidney. Second, we are doing X-rays. X-rays means X-ray KUB. KUB is kidneys, ureter, and bladders. It is sensitive around 75 to 80% stones can be picked on X-ray. But gold standard, gold standard is an investigation where the chances that you can miss the stone is very rare. So that is called CT KUB. CT KUB is gold standard. Even you can pick 2 millimeter stone in the kidney system. So CT KUB. Before there was another investigation, an X-ray investigation was called IVU. Nowadays it is almost not being done, but it is one of the modality in which we inject contrast into the vein, and this contrast goes into the blood, and from the blood comes into the kidney and in the urine, and there are serial X-rays, so you can see whether there is any stone, because it starts with a plain film. So if there is any stone looks white on the X-ray, and after that the urine which is containing the contrast will come into the urinary system, so you can see the urinary system. Is there any blockage? Is there any enlargement of the kidney or not? So that is currently Maybe in areas where, if for example they don't have a CT scan, so then they can do an IVU, but mostly CT-KUB is now the best modality of diagnosing the stones. And another non-invasive, I should have mentioned that before, is the ultrasound, right? Ultrasound can pick the stones even less than almost 4 millimeter, 3 millimeter stones can be picked by ultrasound in the kidney and in the urinary bladder as well. But ultrasound can't pick any stone in the tube which is between the kidney and the ureter. So the stones which are there in the ureter, they can't be picked by ultrasound. But ultrasound is a good modality and non-invasive without any risk of radiation. However, in the CT scan, there is a risk of radiation. That patient may develop, exposed to radiation.
If there is an emergency situation, like a patient comes in, like probably the patient has had a silent stone, so there is an acute renal failure whereby the person suddenly cannot pass any urine or any other symptoms of acute renal failure. So at that moment, what would you do to relieve the obstruction caused by kidney stones?
Okay, in emergency, as I said before, we should give painkillers, and then if there is a blockage, so there are two methods that we can, in emergency cases, relieve this obstruction. One is called, there is DJ stent, double J stent insertion. It's in a tube, will insert through the urinary tube from the urinary bladder into the kidney. So one end of that tube is in the kidney and second is in the urinary bladder. So this will bypass the stone if there is a blockage in there. And this needs anesthesia. If, for example, patients come with in emergency with blocked kidney, as you said, or infection, so then the second method, which doesn't require any anesthesia, is percutaneous nephrostomy. Percutaneous nephrostomy is again a tube, but it can be put from the back side, from the area of the kidney, directly into the kidney to divert the urine, which is, for example, blocked in through the normal way, so the urine will drain into a urine bag or a pus, whatever is there, that should drain, and kidney can be, the blockage can be relieved, and then later on you can treat accordingly if once the emergency situation is dealt.
When patients present to you as pain as the hallmark symptom of kidney stones, what is the location of that pain?
Pain, mostly kidney pain starts from the right side of the abdomen, and then it radiates toward the inguinal region and toward the genitalia, and sometimes toward the back, but mostly toward the anterior side, means on the front side, and toward the inguinal or genitalia. So this is the hallmark of the renal stones.
And what is the nature of the pain?
Renal stone is a very dangerous, as you mentioned before, is a colicky pain, and a very severe pain most of the time if it is blocking the ureter. If it is in the kidney, then it can be a dull pain, but mostly a colicky pain.
So since we have talked about the symptoms, about the causes, or about kidney stones, now we come to how do we prevent kidney stones from forming?
Kidney stones can be prevented by taking a lot of fluids, preferably water, and there are certain chemicals, as I said before, like straight, the juices which are contained straight, right? And second, you can take milk, but as I mentioned before, 1 or 2 cups, not more than that. And third, there are certain medications you can prevent with, if somebody is with the hyperparathyroidism or somebody is with the metabolic disorders like uric acid.
Who already has a risk factor.
So it is a risk factor. So you have to treat those risk factors so you can reduce the risk of stone formation.
What about diet? What kind of diet should the person observe?
Yes, a diet, there are certain, as we discussed before, most of the stones are calcium and oxalate containing. So we should avoid those foods and they're rich in calcium, like taking more milk, like taking red meats, right? Meats contain oxalate as well as uric acid, and like chocolates, spinach and strawberries, nuts. These all are rich in oxalate and calcium, so we can avoid taking these sort of foods to reduce the risk of stone formation.
When you say to drink enough water, so how much water should a person drink in a daytime to prevent from being dehydrated that would lead to kidney stone formation?
The best way to know that how much water the one has to take is the color of urine. If the color of, it depends on the environment. If you are in a cold environment, you might need less water. If, for example, somebody is in a hot environment, he or she needs more water. So the best judge is you have to see the color of urine. If the urine color is white, so it means you are taking enough water. If the color of urine is dark or yellow or dark yellow, then it means you are short of fluids. So an average 2 liter, 2.5 liter is for an 60 to 70 kg man is, I think, normal.
Most people lack information on healthy lifestyles and how to avoid such diseases like the one we talked today. What advice would you like to give our viewers on how to observe healthy lifestyle?
Healthy lifestyles means you have to balance your diet, you have to do some exercises, take plenty of water, and avoid taking those foods which are, as we mentioned before, they become a source of a kidney or urinary stones, like rich sources of oxalate or a calcium or a uric acid. And another important thing is avoid being dehydrated, as we discussed before, and the third thing is to avoid delaying the urination. If you are delaying the urination, there is a stasis, and stasis can leads to infections, and infections leads to stone formation as well. However, it is rare, but it can be.
Since we talk on the treatment option, what are the wide varieties or modalities of treatment do you offer?
If the stone is less than 5 millimeter and it is not causing any blockage, so we can observe, as we discussed before. And a stone more than 5 millimeter, then there are options, and it depends on the site of the stone, the size and the site of the stone. Modalities include extracorporeal shockwave lithotripsy. Extracorporeal shockwave lithotripsy is basically a method. By that method, the patient can be given a treatment by a machine which generate shock waves, and those waves are focused by an ultrasound guided or an X-ray guided on the stone in the kidney, and it will take 30 to 40 minutes to bang those stones into the pieces, and those pieces then can flushed out into the urine.
So does this treatment modalities depend on the size or location of the stone?
Yes. It is
both.
Size, for example, a stone which is in the kidney, so you can use the modality, as I mentioned, extracorporeal shockwave lithotripsy, if the size is less than 1.5 centimeter in the upper pole of the kidney, because in the kidney there are 3 poles: lower pole, middle pole, and upper pole. In the upper pole and middle pole, if the stone is 1.5 centimeter or 1 centimeter, you can give extracorporeal shockwave lithotripsy. If the stone is in the lower pole of the kidney, then the treatment modality changes. Now with the recent advances, there are endoscopic. Urology has now become a endoscopic. Endoscopic procedure means for a kidney stones, percutaneous nephrolithotomy. Now, percutaneous nephrolithotomy is a method by which there is puncture from the backside directly into the kidney. And then within a camera, a small keyhole tract will formed, and through that track the camera introduced, and with the camera you can see all over in the kidney where is the stone. Then you can bang the stone into the fragments, and fragments can be removed by those the tract which has been formed, and stone can be treated. And then, as you said, the site, if the stone is in the ureter, so there is another modality is called URS, or ureteroscopy. Now, ureteroscopy is a good modality of the stones in the lower part of the ureter, in the middle part of the ureter. If the stone is in the upper part of the ureter, then as I mentioned before, extracorporeal shock wave lithotripsy would be the first option, and the second option would be the ureteroscopy. So the ureteroscopy again is in a long, small, almost 6 and 7 French telescope. That scope can goes in from the urinary tube into the bladder, and from bladder into the ureter, and then the same device which has been, for example, being used in kidney for fragmenting the stone can be used in the ureter, fragment the stone in pieces, and the pieces can be removed. Then the fourth modality is open. Now open surgery, now recently in the advanced era, is rarely being used, right? For example, in the places where these endoscopic or advanced instruments are not available, then the open operation means the cutting the muscles and go inside and remove the stone from the kidney.
So as you said, in the upper and the middle pole, the stone has to be around 1.5 centimeter or more, so that you can use these treatment modalities that you have mentioned. So what if it is less than that, maybe a 1 centimeter stone or something? Does it bring about symptoms such as pain, or does it have to be around 1.5 centimeters so that it can bring about the symptoms?
You know, in the kidney, if any stone more than 5 millimeter can be treated with lithotripsy. That is called extracorporeal. From 1.5 centimeter, from 5 millimeter to 1.5 centimeter, we can use extracorporeal shockwave lithotripsy, which is a non-invasive. Non-invasive means doesn't require patient to be in anesthesia. So we can use the extracorporeal shock. If any stone, even sometimes the stones in a lower part of the lower pole of the kidney, or a stone more than 1.5 centimeter, the best treatment is then the percutaneous nephrolithotomy, as I mentioned.
If the stone is very small, like less than 5 millimeters, so can it be treated by drinking enough water so it can be flushed out?
Yes, that's what initially I said, that for example any stone less than 5 millimeter, because it's difficult to focus the less than 5 millimeter stone on extracorporeal shockwave lithotripsy. So the best modality is then observe and ask the patient to take plenty of water, so that it can be flushed. There are two possibilities: either it can be flushed out, or either it can increase in size, and then you can focus and treat later on.
As you've mentioned, a wide variety of treatment modalities that may be used to treat kidney stones. Are all these treatment modalities available at your institution for treatment?
We have almost we can treat 90% of the stones. However, we don't have the external extracorporeal shockwave lithotripsy, but we have the contact lithotripsy, or is called intracorporeal shockwave lithotripsy. So we can treat stones in the bladder, we can treat stones in the ureter, and we can treat stones in the kidney as well. So those stones, for example, if any stone, as we mentioned before, less than 1.5 centimeter, or sometimes 7 or 8 millimeter stone which is not causing any blockage, and those stones can be treated with extracorporeal shockwave lithotripsy. So extracorporeal shockwave lithotripsy we don't have, but we can treat 90% stones with the ureteroscope, with the percutaneous nephrolithotomy, and as I mentioned at the end, that open surgery is a modality. You know, sometimes There are stone disease, or there is a stone with associated any congenital anomaly of the kidney. The kidney, the junction of the ureter with the kidney is narrow, is called pelvic-ureteric junction obstruction. So you can open in one sitting, you can correct that congenital anomaly as well as remove the stone. So there is still less, you can say, importance of open surgery in the stone disease, but mostly you can treat, and alhamdulillah we have all the options we can treat.
So if you have had a patient who has had a kidney stone and you got him treated, what is the chance of recurrence of kidney stones?
Yes, it's very important questions. If somebody had a stone once, then there is a 60 to 70% chance that he may develop another stone. So it is very important that we can do the stone analysis to know the exact nature of the stone, what is the type of the stone. So then after that you can explain the patient to avoid, for example, in a calcium stone, so you can explain the patient to don't take those food or drinks which are containing more calcium, or it is an oxalate stone, so you can also explain or advise the patient to avoid taking those foods or drinks which are containing the type which the stone is.
So how would you know the kind of stone that the patient has?
There are nowadays there are 3 methods that we can know. For example, now you have the stones, you can send it to the laboratory. So in the good laboratories there are 3 types of stone analysis methods. One is called infrared spectrometry. You can even 99% say whether it is a calcium, whether it is an oxalate, whatever the type is. And then other is called X-ray crystallography. And the third one is not much advanced, so it's available all over the most of the parts of the world, is called chemical analysis. So that is also sensitive, but not as compared to if the stone has been tested with the infrared spectrometry or it has been tested with the X-ray crystallography.
Although we hate pain, we try every method possible to alleviate pain, but pain is actually a blessing from God, because it's only when a person is in pain that the person will want to visit a doctor, right? So if at all a patient has had pain due to kidney stone, and the patient keeps on taking painkillers that kind of treats the pain and gives relief for some time, how dangerous is it to prolong the kidney stones?
It is very dangerous, as you said. It is a blessing for us from the God that pain is a factor that it leads to you to go to the doctor. And if, for example, a patient with the pain and taking just painkillers, then if the stone is in a place where it is blocking the kidney totally, so there is a risk of infection, there is a risk of back pressure, and kidney can bear this back pressure for some time. Maximum, if the kidney is 100% blocked, 2 weeks, or if you will further extend, it's 3 weeks, right? Most of the evidence all over the world is suggesting don't let any stone be there if it is silent more than 4 weeks, maximum more than 4 weeks. Otherwise, the kidney is going to be failed. So whenever there is a pain, one has to go to the doctor and see and evaluate whether there is a stone which is causing blockage, so that the treatment can be taken. And one more important thing, people start taking painkillers on its own. And there are types of painkillers. They are also nephrotoxic. Nephrotoxic means dangerous to the kidney. So if somebody's kidney is blocked, there is an infection, and because of that infection, the kidney has become compromised. And on top of it, if the patient is taking the painkiller which is dangerous to the kidney, so it will increase the risk of kidney failure more. So there are some type of drugs which are safe for the kidney. So it is important for the community, if there is a pain, so they should consult a doctor at least, and evaluation, just not taking the painkillers.
When we talked on the location of the pain, you say it starts on the right flank and then it moves towards the groin area, and So how different is the pain from the other pains, like the pain of appendix or something? Because if the patient might be confused at that time, that I'm having such severe pain, it might be due to a swollen appendix or a ruptured appendix or something of that sort. How different is the pain of kidney stones from the other pains?
Yeah, it's a very important questions. If for example, a kidney stone on the right side or in the right ureter can mimic like a pain in the appendicitis. So that's why after taking a good history, for example, was there any history of family history, and then a thorough examination, because appendix gives a localized pain, and when you touch the appendix, so it is painful. And ureteric or a kidney stones, you might not find those signs which are present in appendicitis. So this is one way to differentiate. And second way is that as we mentioned regarding the modalities of investigation, so nowadays CTKUB is a very nice modality that you can although see the stone and as well as the appendix. Is the appendix is, for example, inflamed, there is a mucolith which is blocking the appendix and is giving pain, so you can diagnose, or there is a stone, so you can differentiate between. However, whenever the patient comes, so you have to first diagnose. So one of this modality you can differentiate. On your clinical examination and history taking, you can still miss, but when you do the further investigation, so you can make the correct diagnosis.
In case of a silent stone, which you have probably diagnosed accidentally, or probably the patient has already started showing signs of renal failure, so is it reversible, as in the extent of damage that has occurred to the kidney? So can the kidney be revived again, or probably a small percentage of the kidney will be dead?
Yes, whenever, for example, a stone which has blocked the kidney, and for as I mentioned before, more than 4 weeks, then it depends whether it is blocking the whole kidney or it is blocking one of the calyx, right? If it is blocking one of the calyx, so then the portion of the kidney which is drained by that calyx can be damaged. And if it is blocking the ureter or the pelvic-ureteric junction, so it means the whole kidney is blocked. This is the golden period, as I said. If you are removing or relieving the blockage within this golden period, so there is a chance that you can revive the 100% kidney functions. If it has been delayed, then it depends on the again the duration. If it was the prolonged duration, so it means then the kidney is gone. But there are ways that, for example, you have to first relieve the infection stone, and then there is another modality you can check whether the kidney is functioning or not. One is, as I said before, you can put in a tube which is slightly an invasive directly into the kidney and see whether kidney is forming urine or not. But best method is an X-ray, that is a nuclear imaging, is called DTPA. That exactly can say how much this kidney is functioning, how much normally 50% left side is functioning, 50% right side, so it's 100%. If one kidney is blocked, so then it might stop functioning, right? So if you do that test, that will shows that whether this kidney is functioning, and functioning how much. Is it functioning 20%, 30%, or even non-functioning?
Okay, as we are approaching the end of our show, doctor, what advice would you like to give our viewers?
As I said before, the best prevention is better than cure. So taking plenty of water is an important aspect. And if, for example, somebody's family is positive for kidney disease, so then they should be evaluated at least once a year if there is any silent stone, so that that can be dealt. If for example somebody had a stone, had a treatment, now he is cured, so if he knows the type, so he can avoid taking the food and drinks which are containing the type of stone, or he don't know, then plenty of water is the best way to avoid the stone formation and going to the doctor as well.
Thank you so much for coming to our show, doctor. I'm sure our viewers have learned a lot from our show today. Thank you so much for watching. Khuda Hafiz.
Thank you.